Hello everyone, and welcome to Health Law Talk presented by Chehardy Sherman Williams. Before we get started, please be sure to subscribe to our podcast and follow us on Facebook, Twitter, LinkedIn, and YouTube, linked in the description below. We hope you enjoy this episode.
Hello, everyone.
Hello everyone.
Welcome to another edition of Health Law Talk with Conrad, Meyer, and Rory Bellina. Rory, say hello.
Hello everybody.
We are here at the law firm of Chehardy Sherman Williams, and we are going to bring you fantastic topics dealing with health law talk. So sit back and relax as we take you on a journey into the health law region, right, Rory?
That's right.
Let me tell you a little bit about the firm. This is our first podcast, and we want to go ahead and kind of introduce ourselves and sort of give people, our listeners, a background about the firm. We work at a firm called, Chehardy Sherman Williams, as Rory knows, we all know. But Chehardy Sherman Williams is one of the largest law firms in Jefferson Parish, Louisiana. We are a full-service firm. We are devoted to serving the New Orleans region. We started back in 1989, and when I say full-service firm, Rory, you know what is a full-service firm, so our listeners can know what that means.
Sure. I think a full-service firm means that we cover everything. We have attorneys and staff here that are able to cover all legal needs, whether it varies from estate planning, litigation, healthcare work that we obviously do. There's someone here that can assist with everything.
And I think when we look at the firm website, for example, we got everything from attorneys who can handle appellate work, banking, business, commercial litigation, everything, the gamut, labor, employment, real estate, estate planning, and really what we're here to talk about, healthcare law.
Yes, that's our specialty, and that's what we're here to educate you on.
Absolutely. So tell me, Rory, this is our first episode. We plan on discussing various health law topics, having guests on the show, and I know that we're giving people sort of the background about us. So tell us a little bit about you and your journey into healthcare law.
Sure, thank you. I've been an attorney for over 7 years now. I was born and raised in this area. Went to LSU for undergrad and then Loyola Law School, and I've been practicing at this firm for a little over 2 years and been a healthcare attorney for almost 6 years now. So it's been a really fun time, and every day I learn and get to do something new.
I think most people would agree that if you can come to work and you enjoy the work, that's a pretty unique situation. So how, when we get into talk about healthcare law, some people might find that a little bit either intimidating, boring, interesting. So I think it just depends on your background. But I'd love to know, and I think our listeners would like to know, a little bit more about Rory and how Rory Bellina became a healthcare lawyer. So tell us about that.
Sure. And I think the first question I get when I tell someone that I'm a healthcare attorney is they say, "Oh, you do malpractice," and that's when I have to jump in and say,
No.
We
Right.
have a full team here that does handle the malpractice, but I'm on the other side. I'm on the regulatory and compliance side. So everything that, from the ground up, from entering into leases, provider agreements, getting physicians credentialed, all the way up to fraud and abuse regulations, it's a full gamut on the regulatory compliance side. I know, Conrad, I have experience on the malpractice side as well, and so that's kind of where you and I cross paths sometimes.
We do. I mean, I wear two hats. So I handle things that are in your wheelhouse that you were just talking about, but I also do the professional liability side. So I'm wearing two different hats, and it's a little challenging, but I find that it's also a very interesting model because sometimes the regulatory compliance transactional side does cross over into litigation on a different level. So having that knowledge, I feel like it's been helped me in my practice expand and be able to cover both sides.
Absolutely. And I know when we were preparing for this show, we made an outline of topics that we wanted to discuss today, as well as on upcoming episodes. And Conrad, what are some of the things that we want to bring to our listeners?
So I think what we talked about initially was this introduction, and then we're going to start working on topics that matter not only to healthcare practitioners, but honestly to just the regular people in general who might be interested in understanding a little more about healthcare law and what that encompasses. I think some people don't really understand that healthcare and the industry itself is so huge. I mean, you're talking about 1/5 of the country's GDP, and which is a tremendous amount of funds in one industry. So when you have that, and the amount of topics that can spin off from that, Rory. I mean, you mentioned just a couple of things earlier about the size of the firm in terms of the things that our Chehardy Sherman Williams can do, but a lot of those things also transcend into healthcare. What do you think about that?
Yeah, I think that the healthcare industry, if it's not the most regulated, it's probably number 2 from a regulatory and compliance standpoint on state and federal rules. The big question that I get from clients that come in is, I want to start a medical practice. Where do I start? And we start with the easy questions of where do you want to be located? What do you want the name to be? How do you want to compensate people? But then that question really expands as far as what providers do you want to be enrolled with? Do you want to take insurance? Do you want to be on different medical staffs? How are you going to get credentialed? It's of such a regulated and expansive practice area that a lot of physicians or providers or allied health providers, they don't know. And I think a lot of them will come in and say, well, I went to med school and residency and I know how to practice medicine, but I don't know how to open up a clinic, or I don't know how to get enrolled with a big payer, or can I do this if I take Medicare? Those are the questions that we're here for and we're able to help with, and it's ever changing, especially with this past year due to COVID.
I totally agree, and I think in addition to just you and I kind of discussing these topics, we're going to have some guests that kind of cover their topic area. So some really interesting and very experienced people in their field come on the show and really help enlighten our listeners with the topic at hand. So I think that's part of the goal, and eventually we might be working our way into a live stream with call in, and I think because we're very excited about this. This is a very big opportunity, and as you were pointing out, it's so varied. I mean, there's so many topics. There's such a like you said, it sort of expands just on that simple question of I want to open a practice. It goes into liability coverage, reimbursement. You got real estate. You've got labor. You've got I mean, all the things that you would never really think of. Suddenly, like, wait a minute, this is really kind of a big deal.
And then if you add in that you want to take Medicare or Medicaid, it explodes.
Oh, it's a bigger deal because now the feds are involved, right?
Correct. And those rules are ever changing over the past year due to COVID. We were talking about this off air. For as devastating as COVID was for businesses, families, individuals, everyone across the nation, it really did some wonderful things for the healthcare world, for kind of loosening regulations and expanding on telehealth. And I know that's an area that we've been following very closely, and
we have,
and hope that these expansions are not rolled back, because it's really accelerated. And kind of cut the red tape per se, possibly 5 or 10 years in the future, I would say.
It just goes to show you that when there is some sort of an emergency need, all of the things that healthcare lawyers and legislators, whether they're state or federal, that have been regulators that have been working through these issues, whether it's telehealth or something else, they literally cut the red tape in a week. And like you said, cut 5, 10, 15 years maybe of constant, I guess, back and forth to kind of tailor some regulation. So I think that's really important to know and help our listeners navigate some of those complex issues. Now, back to what I was telling you earlier before. You were mentioning that you've been practicing 6 years. But before that, why don't you tell our listeners a little bit about how you became a healthcare lawyer? Because that's the question I get from students that I teach sometimes. They say, well, how in the world do you even get to be a healthcare lawyer? How does that work? So why don't you tell the listeners a little bit about your journey as to how you even started practicing healthcare?
Sure. So I was actually pre-med in undergrad, and about halfway through undergrad, I decided, this wasn't going to be for me. I really enjoyed all the courses I was taking. I was an EMT. I spent a summer performing autopsies at a local hospital system here. But I just realized that this was not. I was more interested in the legal and regulatory side of healthcare and medicine than the actual biology and chemistry and physics side. And so I, stayed course with my degree and graduated from LSU, but didn't even apply to med school. Just applied straight to law school, and luckily got in, and knew that healthcare was the practice area that I wanted to go into, and I've been here ever since and never been happier.
So you were lucky enough to actually land a position right out of school directly in healthcare.
It took a firm. It took one firm that I kind of cut my teeth on right out of law school, but I knew leaving law school that I wanted to get to a firm that did a lot of healthcare work. And so I was at more of a general law firm in the area and got some great experience there, but knew that this was the practice area and the firm that I wanted to get into. And I've been here and been very blessed ever since.
That's great.
And I know that you and I probably would have crossed paths if we were a little closer in time. I think we have similar backgrounds if you want to expand on that.
Yeah, I do. I mean, I think the EMT route, that's very interesting because I was an EMT as well. So my journey started in pre-med just like you in college. And when I was doing that, I was doing everything I thought was right. I studied like you wouldn't believe. And I got to the point where I was applying to medical school, and I got waitlisted for the first year. And I said, I'll take the classes and reapply. And I thought that was my journey. I thought that was where I was ending. I did the EMT route that year, and I vigored at the New Orleans Health Department for a little while. And then I decided to apply, and I got waitlisted again, but this time I got accepted into the Tulane's MHA program, so I felt really blessed. And after going to the Master's in Health Administration at Tulane, the first semester was all about business, and it was in the middle of the 1996 HMO sort of craze. And I realized that my personality wasn't going to fit. And so I stopped worrying about med school and thought, let me go look at hospital administration. But when I went to Lakeview Regional as a resident administrator in the C-suite, I realized, they transfer so much. And I am a New Orleans native. I was born and raised in New Orleans. So I don't want to, we both were. So I don't want to leave. When you're in New Orleans, you kind of stay, right?
Absolutely.
Not only do you stay, but your family stays, your kids stay.
Yes.
It's kind of a unique city in that we have a lot of people who don't want to leave, and I can see why. It's a beautiful area. So I decided to go to law school, and while I was in law school, I focused solely on healthcare. And I was lucky enough to get out and start my career right in healthcare law, and I've been doing it for 20 years ever since. So it's been a labor of love, and I would not change a thing at all.
Sure. And the way that you explained your path is similar to mine, that we both enjoyed the legal and regulatory side more than the actual medicine side. And I think we get a lot of clients that appreciate our background and our experience.
Yeah, because part of the issue is can you talk in a similar language that providers can understand? And I mean similar language where it's not like law, right? Correct. That you're not speaking the regulation. You're speaking things that they can relate to, they can understand. And a lot of times we say no, because a lot of times physicians will call, providers will call and ask us questions. And if I had a nickel for every time I was saying no, that you can't do that because of the regulations, but our ability to transcend that from a book or a reg into a common language so that physicians, providers, they can understand that, I think is critical.
Sure, absolutely. Completely agree with that.
So when we start doing the show, I know that we're going to be producing a show pretty much every 2 weeks, and we're going to have people on a schedule so they'll know when the show comes out. We're going to be consistent with that. And as we evolve over time through topics like COVID and telehealth, pharmacy benefits, even CLIA labs or anything like that, Stark, any kickback, which is like most of our listeners might not even know what Stark or any kickback is, but we can go into that, so that they understand a little bit more about how healthcare, the industry, affects not only the providers but also them.
Absolutely.
So we're gonna be doing that. I think every 2 weeks, and we'll have some live guests. I don't know who we're gonna get our live guests first, but I'm sure it's gonna be great. What about the social media thing? I think can you relate to that? What do we have going on there?
Yes, everyone will be able to subscribe to our podcast. It's going to be broadcast on all the major podcast platforms. You can also subscribe to our YouTube channel, our LinkedIn, and follow us on Twitter. All those social media links will be provided in our bio and the description below with this podcast.
That's excellent. And I think we're going to have one of our other partners join us pretty soon,
Yes.
Mr. Mueller, George Mueller. Isn't that right?
Yes, he is. He's been instrumental in the healthcare world. He is, I would call him an expert on mergers and acquisitions, and we have done some really interesting ones recently over the past couple of years, and that's another really big topic, especially as the healthcare landscape is changing. You're seeing a lot of these practices getting purchased up by private equity or bigger systems, and navigating that. And I think the goal for a lot of providers is, I want to build my practice and then retire from it. But I think that goal has somewhat shifted, and now we have providers that build these practices and then they get purchased out, and helping them navigate those fields, because that's very popular right now, especially in certain specialties.
On the private equity side, correct?
Yes.
And that's interesting, because then you have to navigate when you look at a practice, and we're going to get into that a little more detail, but when you look at a practice, most of the physicians or the providers in the practice are different ages. So you have to manage who's wants to get out, right?
Correct. Who wants to stay? Who
wants to stay, and who's staying and who's going?
Non-compete, equity. Yes, it's a very interesting thing. And then the regulatory side, because some states don't allow certain things where some do. So it's a very interesting legal field.
So we have a lot of content, a lot of interesting topics that we're going to be bringing to our listeners, and we are very excited about that. I can tell you, we're going to be firming up our social media pages. We're going to be looking at making sure that we stay connected with you and you stay connected with us.
Yes, we want questions to be submitted. We want people to write in and comment if they want certain topics or certain guests to be interviewed. So please be sure to contact us through all of our pages. We're also going to have our contact information in the bio and description for this podcast. So if you have a question or comment, concern, something that comes up, something you liked or didn't like from this podcast, feel free to call or email Conrad or I.
That sounds great, Rory. Well, we want to thank everyone for listening to our intro here. We're very excited about this opportunity to bring this healthcare content to our listeners, and we're looking forward to connect with you. Rory,
Yes.
Closing thoughts?
Thank you for listening, and please subscribe to our podcast. Thanks for listening to this episode of Health Law Talk presented by Chehardy Sherman Williams. For more information or to contact us, please visit our website linked in the description below. Also, please be sure to subscribe to our podcast and follow us on Facebook, Twitter, LinkedIn, and YouTube.